called Dentistry in the Community, where we'll be on Princess Street, and we'll be doing educational sessions and screenings of...
Screenings meaning like a bit of consultation?
Consultation, oral examination, and for those who actually need further treatment, we'll be like referring them to the various dental clinics.
That's awesome. So you guys, what day would that be?
On Thursday.
On Thursday, they're going to have oral health drive on Princess Street. I think you guys can take advantage and go on out and support. And also, you can also see if any one of you guys have any issues, if you have to be referred, if, free consultation is something you can take advantage of. So we can move along. Do we have any other activities for the week? Is Thursday the final?
No, well, on Friday we're having a staff appreciation event where, because it's a whole week of activities that we worked hard, we need to appreciate the staff and show them the importance of actually being responsible for a healthy mouth in this federation.
Okay, that's awesome. So we're going to go right along with our presentation. Anyone else has anything to add before we move on? That's fine? Okay. So we're going to go to the first slide, and I would have Dr. Liburd. He can get right into his presentation.
So good evening once again. So we are here to basically have an education session where there's a definite connection between your oral health and your mental health, where if you're free of pain, it means that it improves your overall mood.
True.
And it's also you're free from infections, and you'll be able to eat properly, and you'll be able to sleep properly.
And it's very telling on your social connections, because if you can't smile, it can be a bit socially awkward.
Yeah, your interaction with your peers, going to be limited. There's also issues where they can make you miss work or school. That affects your job and your academic performance. And the thing about this is that all these diseases are very preventable. So here's where we are to encourage and motivate each and everyone to at least have a dental checkup every 6 months.
Every 6 months? Yes. I thought conventionally it was once a year.
No, it's best every 6 months where you have enough time to actually guide and have a proper treatment plan before it's too late, and you have to...
Statistics show that the dentistry, the mouth, is one of the most neglected areas that people overlook. Is that true? What do you find so?
Yes, we find so.
People take their mouths for granted?
Yes, they do. The patients often tell us, I love to eat, I love my mouth, but but connected to that though, sometimes even though they claim to love their mouth,
they forget to take care of it.
Yes, and only show up when trouble comes.
Oh.
Yes.
Oh, wow. Okay, that's interesting. Anything else you'd like to add before we move along?
Well, also having a proper oral health improves your quality of life. Not only social, but quality of life, where you'll be able to eat, laugh, talk without worry or discomfort. And this sort of improve your self-confidence in interacting with your peers.
Gotcha.
And it's also help you to smile more often rather than covering more because you have some sort of dental issues.
I can see where that would be a problem for real. And sometimes in our society, persons who tend not to smile, people tend not to trust you. And so you might be, honestly, you might be excluded from social interactions innocently. You might not be an untrustworthy person, but other people would perceive you that way because you're not smiling as much. You seem more closed. Body language-wise, persons can misinterpret you a lot. Yes.
Okay.
I remember a colleague said to us some time ago that when Marriott first came to St. Kitts, they had a big billboard, and the billboard was saying that we hire smiles. So you show you the importance of a smile.
That's true. I never even thought about it that way. If you're in the tourism industry, you for sure you need that smile. The tourists, they really go off of the smile. Okay. So we're going to break. We're going to pay a few bills. And when we come back, we're going to elaborate a lot more on the dental health and what we can expect moving forward.
Can I get a wow? It's the sound you'll make when you get out alone. From a place you once knew to a dream home come true. Wow, for a home like new. Wow, is the effect you'll get when you upgrade your home.
Upgrade, improve, enhance your home with National Bank's Wow Mortgage for the effect you'll get when you upgrade your home. Lowest interest rate guaranteed and the most favorable terms.
It's Wow Mortgage. Can I get a wow?
And welcome back again. For those of you who are just joining us, welcome, and who has been here from the before, welcome back. And our topic for this evening is a healthy mouth is a healthy mind. I don't think some persons know the connection or the distinction between how important your oral hygiene is to your mental health and your mental state. But if you really stop to think about how important your body language is, how you come off, just your smile, your appearance, it counts for a lot. So I would let Dr. any one of you can continue elaborating on the topic right now. So who's going to take the floor here?
If I may,
Sure.
In the event of social media, like a lot of selfies, a lot of good pictures and things, so that in itself like helps you to smile a lot. But when you hold back your smile, it can impact both on how you feel and how others perceive you, as you alluded to. So, for example, aesthetically, if somebody like have a lot of cavities to the front, like, they may not want to smile.
Yes.
Right.
You see?
And socially speaking, persons will look down on that person as well,
Yeah.
Yeah.
And smiling not only reflects happiness, but it also enhances your emotional well-being. So smile can give you, a healthy mouth can give you the confidence to smile more often and improve your overall mood and mental state.
Awesome.
And what we also try to do is from an early age, we try to instill good oral habits in children so they can have brighter futures. So these habits not only support their physical health, but also contribute to the overall well-being as they go.
So can I ask something that might sound a bit controversial? In your clinical practice, do you find parents pay attention to their children? Because if in adults they're not maybe too cognizant to what's happening with the children, do you guys have to find more creative ways to get through to the parents to make sure that the children are not lagging behind with the oral health?
No?
Well, when parents bring the children, we encourage everyone to pay attention to the oral health, pay attention to the brushing, the correct times, the flossing. Mm-hmm. But sometimes we find that you can see the connection, whatever the child's mouth, whatever the parent's mouth look like,
That's what
it reflects what the child's mouth look like.
That's
and both good and bad.
That's what I was alluding to without
Yes.
trying to get into trouble.
There's a
so I'm glad you
connection.
said it.
There's definitely a connection in who, because remember, parent can only teach what they know.
What they know. It's similar with your diet as well. You find
Right.
persons who are obese adults, they tend to have children with weight issues as well. But I wasn't sure if that was directly translatable with the oral thing
Yes,
as well.
we see it as well. Similarly, yes, we see it.
So then how do you break that cycle? If the parents is having issues, how do you help the child?
Well, we continue to encourage, we continue
Gotcha.
to teach, continue to instruct, but
Gotcha.
we only could lead the horse to the water.
I understand fully. I totally understand, but that is quite a challenge for real.
Yes.
Is this the time we're going to do?
Yeah.
Okay, can we have the video, Miguel?
Toothy here, ready to discover how oral health is connected to your mental well-being?
A happy mouth is a happy mind. what you'll find. Brush and floss and you will see the joy in being cavity free. With the proper dental care, let's spread happiness everywhere. Happiness everywhere. Happiness everywhere. Cut the sugar, have no doubt. You feel good inside and out. Happiness everywhere. Happiness everywhere.
Happiness everywhere.
Wow, I really enjoyed that few seconds of Toothy the Beaver.
Yes.
It's very
Exciting.
interesting. I'm sure the children would catch on to this one. So can we have the next slide about the oral health disorders? So we're going to, I guess, discuss some of the common clinical issues that you see. I guess that's what, slide number what?
13.
Can we have slide 13, thanks? 13. Okay. So we're going to continue. We're going to elaborate on the different oral health disorders. So anyone can take the floor.
So what we try to do on a daily basis in terms of functionality, we have what we call outpatient clinic. So this is where you come, you get your examination done, and there are certain disorders that we actually pick up in terms of dental cavities, inflammation of the gums, everything. But specifically, we want to sort of elaborate on certain disorders that it's common enough, but we don't pay attention to it. So one of the disorders is what we call dry mouth, and I have Dr. Rawlins.
Also, dry mouth is an actual medical condition. I just thought that's when somebody talked too much. I didn't know it was a pathology. So who's going to be the one to open the floor with that one?
Oh, okay, right. So as Dr. Liburd alluded to, dry mouth, it's a fairly common condition, and as it says, it's quite self-explanatory. It's when your mouth feels dry, and we realize that when your mouth, we know that our mouth has saliva in it, and if for everyone to understand, it's spit, right? It is the saliva and it has about 4 purposes. For one, it's the natural wash of the mouth. It helps to flow, the saliva flows and it clears out all the debris that might be in your mouth after eating. Another purpose is it's a natural lubricant. If you realize that when the digestion process begins in the mouth, and so once we start to eat, the saliva flows.
It breaks down
it
some
helps
of the food
to soften
already.
the food in preparation for swallowing. Right. Another purpose, it's a buffer, or it helps to neutralize the acid. When we finish eating, our mouth is an acidic environment, an acidic place. And an acidic place encourages growth of bacteria.
And tooth decay.
And bacteria is what causes tooth decay. So once you have an acidic mouth, you're having bacteria thrive, and increases the possibility of getting cavities. So what the saliva does, it comes now and it causes like a neutralization process to bring the mouth back from being more acidic to neutral.
So if it wasn't for the saliva, we'd probably have higher instances, way higher.
Cavities, yes, because that's one of the signs of dry mouth, if there's high increase of cavities, right. And then the last purpose of the saliva is it has antimicrobial properties. Therefore, it helps to keep what I mean by antimicrobial means sort of like what we call bugs, bacteria, fungi, etc. And the saliva helps to keep the infection
to a lower.
It keeps the bacteria in check.
Gotcha. It's like a normal flora type of situation for your mouth?
Yeah, it encourages the normal flora, but then of course if it's lacking, the abnormal flora increases, and then we have a problem.
Interesting. I
Yes.
didn't know it was that deep.
Yes.
Okay.
Yes.
If I may add, there are certain medication and health issues that actually contribute to somebody having dry mouth. As Dr. Rawlins explained, like the salivary glands produce saliva, which lubricates the mouth. So in the same context of having kidney stones, you can have salivary stone that actually blocks the duct of the salivary gland. So
That's
it means
painful,
that
no?
It is.
like saliva is producing, but it's not being secreted into
Into the mouth
the
because
mouth
it's being
because
blocked.
it's being blocked by the salivary stones.
So do you get rid of it similar to the way you get rid of, what do you call those, tonsil stones? You have to squeeze it out of the duct?
Well, similar, depends on how big the stone is. You might just have to
Surgery?
make a small incision, and because of the pressure from the saliva being blocked up, it actually pushes it out.
So tell the people, because I know where the salivary ducts are. Where is where is that located, so we can have an idea of the technicality of such a procedure? That's not an outpatient procedure, right?
It can be done in the dental office. So the areas of most common finding salivary stone is actually under your tongue.
Really?
So there's a sublingual gland that's under the tongue, so that's where you normally find it.
So you just squeeze that out? That's going to be so painful.
No, we can anesthetize by spray.
Okay, gotcha.
So apart from smoking, apart from medication, smoking also contributes
To
a
dry
lot to dry mouth. So that's one factor that we also need to look at when we think about dry mouth. You know, smoking is something that's common within
Yes.
our society, so that's something that you need to look at when you think about dry mouth problems.
And I'm seeing here, this would also increase the chances of oral infection if you have the dry mouth.
Yes.
Yes.
Can anyone elaborate?
Right. Well, like I was saying, that's one of the purposes of the saliva. It helps to keep the bacteria in check. It possesses like the buffer. It helps to neutralize the acidic environment, and also its presence helps to keep. If you increase the saliva flow is flowing, if it decreases, then you have the opportunistic infections, they will increase. And that can lead to even a condition called like what you call thrush, oral candidiasis. That's one of the causes of it.
I had no idea. I thought thrush was caused by, I guess, more.
You mean excessive use of antibiotics?
Yeah.
That's one cause, but also if there's no insufficient flow of saliva can cause that.
So then how come, I guess that's an issue mostly in children? Because I see children with a lot of oral thrush. They have dry mouth, no?
Well, then we would have to examine, what was the cause of the thrush?
So you have these bacteria living in the mouth normally, but sometimes in cases where they're immunocompromised, you find that you have an overgrowth of these. They're normally in check. There's a balance. But if there's an overgrowth, that's when you get the manifestation of the thrush presenting in the mouth of the children.
That's interesting. I had no idea. Okay. So we're going to move on to the symptoms of dry mouth. I mean, besides the fact that your mouth will be dry, what are the symptoms? The hallmark symptoms of dry mouth?
Like our Dr. Rawlins was alluding to, so you have calculus buildup.
High what?
Calculus buildup.
We'll have to definitely break that down for the public. That's a medical jargon. What is a high calculus buildup for us, please?
So normally the teeth are white when you're healthy and things, so you'd find that, okay, when you eat, the food stays, I think, and the food gets hard. So these
like
plaque tartar, so that the toothbrush itself cannot remove. So over a period of time, it just gets hard and cover all of your teeth.
I thought that was when you have like cancer.
Not necessarily, no.
There's leukoplakia.
No, it's not the same.
Different, is that?
No, leukoplakia, I think, is on soft tissue. This is what
Not on the gum, it's on the lining.
the soft tissue, but I think what Dr. Liburd is referring to is calculus, hardened plaque on the teeth surfaces.
Continue.
So, so it's the plaque build-up, the calculus build-up, you have cavities, you have gum disease because the bacteria thriving, like you get the gums are being like inflamed, and because of the dryness, you can get your lips cracked. So some of those symptoms actually like becomes very painful. Another thing is that it's more breathing. Because normally it's supposed to breathe through your nose. When you breathe through your mouth, your mouth are open all the time.
Yes, so it's gonna dry. So that like if you're open mouth sleeper, that's a problem.
Yeah, you need to investigate why is that the case. Why are you need to go and check why are you sleeping with your mouth open?
I don't think sleep apnea is a thing that we investigate down here though. Do we?
No.
Because I think people see sleeping with your mouth open as pretty normal.
But then when you wake up, because for example, if you have a cold and you're congested and you wake up and your nose was blocked all night and you wake up in the morning, your mouth is extremely dry. Like what you call cotton dry. So that if you have a cold, fine, but on a daily basis, you might need to go and investigate. Well, why am I sleeping with my mouth open, and how can I get help with that?
Wow. So one of the reasons could be like adenoids, or you can have like a deviated trachea. That's the nose bridge septum. So that will actually like prevents the nasal passage is now reduced. So it forces you to actually breathe through your nose, through your mouth. So.
Right. If you have the sinusitis, I guess.
And sometimes the position that you sleep in also, if you sleep on your back, you find your tongue, it relaxes and it tends to fall back.
To the back of your
Persons open their mouth more to try to breathe. So sometimes the solution to that is to sleep on your side.
Wow. Okay. So, we're going to take another quick commercial break. We're going to pay some bills and we'll be right back. Welcome back to our viewers. I am your host, Dr. Lescott. Our topic for this evening is a healthy mouth is a healthy mind. And I have a whole panel of the nation's finest dentists, and I'm not even joking about this. These people know their stuff. They're very professional, and it's a pleasure for me to have them on our show to bring more awareness to oral and dental hygiene, because it's one area of medicine that is, I guess, a bit neglected in terms of the public care of their mouth. And so we want to help to bridge that gap. And so we're going to continue and elaborate. Who's going to take the floor next?
When we're on oral health disorders, like I said earlier in the program, is we try to instill proper oral hygiene from an early age on. But in some instances, with lack of education or what we think is norm, is actually more detrimental. In this case, we're talking about the baby and breastfeeding or feeding a bottle. And sometimes parents will say, but my child don't eat sweets and everything. How is it that all the teeth are decayed?
Milk.
So this is a condition that we call early childhood caries or baby bottle caries. And I would have Dr. Christmas elaborate more on this condition.
Yes, please.
So early childhood caries, this happens in cases where you find children, they present to the clinic and they have not just one but multiple cavities on their front teeth, mainly on their front teeth. And this happens because the child is normally set to bed with a bottle which contains, it could be formula, it could be sugary drinks, it could be fruit juice, or some other form of sweetened liquid. And because of that, what you find happen is that naturally inside of the mouth you have bacteria living there. And one of the main bacteria that lives inside of the oral cavity is...
Can we have slide 24, please? You can continue.
Okay. One of the bacteria that lives inside of the oral cavity is one that is called Streptococcus mutans. And Streptococcus mutans survives on carbohydrate, sugar. So what's happening is that when you put a child to sleep with a bottle full of sugar, the bacteria, they basically consume the sugar, and one of the byproducts, the end result of they consuming the sugar is that they produce lactic acid, which is the waste. And the lactic acid in turn, it acts upon the enamel of these the thin enamel of these baby teeth, and in turn it causes them to break down, which would eventually lead to the white areas where the enamel become demineralized, and it would further, if left untreated, this would advance to full-blown decay. And as you can see in the slide here, you see the effects of these baby bottle caries. I mean, it's something that we see quite often in the clinic, because some parents, they feel like it's normal. I mean, it's for them to put the child to sleep, they must give them a bottle with some form of sweetened milk or liquid juice, and they're not mindful of cleaning the child's mouth after. So you're basically adding fuel to a fire. So then this is the end result of you adding that fuel, the caries.
Is this painful for the children? It looks painful, but is it?
In many instances, the child presents to the clinic with abscesses, with pain. You know, the mother would say, well, they couldn't sleep all night. They were up all night because the child just kept on crying. I mean, as adults, sometimes you sense pain is coming, and you could take some preventative measure where you might take maybe some form of medication. But these children, they're not in a position where they can detect or sense that they're going to be getting a toothache. So most of the times when a toothache starts for them, it's when it's already too far gone. So they just have to bear this pain until probably the next day when their parents can bring them to the dentist.
Wow. Can we have the next slide?
So normally we try to comfort the child as much as possible. So we give them a pacifier, right? And sometimes we use that as a preventative method for them not to suck the finger. They're going to have more overhead, like deformation, right? But then you find that we tend to dip the pacifier in honey.
I've never heard of that one.
Yes, it normally happens. You dip it in honey, in sugar, and those kind of stuff. And this is very dangerous for the child.
Of course. And do not suck on the child's pacifier, so their parents not do that?
That's strange. I've
Why?
never seen that.
Why?
I've never
I have
seen
so
that.
many questions.
Because sometimes they're like, well, the child learns from the parent.
Also,
so
they're
like, you know,
demonstrating?
yeah.
Okay. Never seen that.
Okay. Okay, so I guess we can elaborate on that topic. We're going to move on to our personality spotlight, but this topic is very interesting. We have to come back to this. Just give us a few. We're going to break for our personality spotlight now.
Melissa Merritt is a veteran of the medical field. With her love of assisting people, Melissa first served in the role of traffic warden before venturing into the medical field, working as an orderly at the JNF General Hospital for several years. Melissa is now stationed at the Mental Health Services at Limekeen, where she is responsible for taking medication to patients, making sure oxygen is available at all times, and ensuring that all unnecessary sharp objects such as needles are properly discarded. Melissa says she loves the fact that her job allows her to meet and assist new people and play a part in helping them to navigate the tough times in their lives. Her motto: find joy in your job.
What's up with you? Girl, you look like you're off in dreamland. Focus.
Focus. It's Valentine's season. Love is in the air.
You not here?
So Dave said he loved me and I have 24 hours to respond. I'm thinking about what I'm going to say.
That doesn't need telling. When he say I love you, you simply say I love me too.
What's that? And who even does that?
I do.
Me too.
I love me too simply means I love me enough to make myself a priority. And it starts with making wise decisions.
This Valentine's, I choose to abstain and to protect my name.
This Valentine, I choose education now, and this is my solemn vow.
I choose to keep my virginity and maintain my dignity.
Wise choice, because saying yes to him is saying no to you. I choose self-respect over self-neglect.
Okay, I get it now. I love myself too. This Valentine, Dave can keep his love. At this point in life, I choose self-love. For learning to love oneself is the greatest love of all.
Hey babe, you know I love you, right?
I love me too.
Welcome back to everyone again. My name is Dr. Monique Lescott. Our topic for this evening is a healthy mouth, is a healthy mind. And with us we have our expert dentist, Dr. Liburd. He's going to continue with his presentation on the issues. Go ahead.
So we left off at the pacifier. So as parents, we try to instill like values into the children. So even though it may not be that common, like we try to not have them develop oral habits of like tongue fucking, right? So that's why I use the pacifier. But then sometimes if the child is hungry, then the pacifier would not suffice. So we tend to dip the pacifier in some sort of sweetened liquid and give it to the child so the child can stop crying.
We can just feed the baby, you know. Okay. So can we have the next slide, please? So we're giving no sodas to toddlers.
Look at that, look at that.
Sugar bites. So people give children, like small toddlers, sodas?
Yeah, that normally happens. Like, because we think that okay, if we give them water, like it don't have any taste, so they would not necessarily take it. Because okay, for example, we are parent like might be busy. You try to do anything to get the child stop crying so that you can continue. Let's say you're doing house chores. Okay, so we tend to give them like sweetened beverages, and we also let the child fall asleep.
Okay, so we're going to move on to preventing of early childhood caries. Okay, go ahead.
Okay, Joe.
So, how do you prevent the development of early childhood caries? One of the recommendations is that you, one, maintain a clean mouth. I mean, you know, sometimes parents tend to think that because there are no teeth in the child's mouth, sometimes they don't have to clean the child's mouth.
Really?
So yes, so it's recommended that you clean the child's mouth regularly. It doesn't, I mean, one of the things about this is that you also get the child accustomed to having some, like, their mouth being clean.
Clean, yes.
Because you don't want to wait until when they actually develop teeth. That's when you start fighting with the child because you expect them to cooperate. Children, naturally, they're going to resist when you put something in their mouth, especially to clean their mouth. So if you get them accustomed to this cleaning routine at an early stage, even when there are no teeth, it's much better, it will be much easier when the teeth are there and you actually continue doing that regular routine.
I saw an elder lady with a 6-month-old, and what she would do is after she's finished feeding, I think she was a caretaker, she would take like a rag and just dab the tongue and the gum. Is that recommended? Is that fine? Because that could count as cleaning the mouth too, right?
Yeah, that's highly recommended, especially for young children. I mean, you get a clean rag, you put it in some clean water, and you wipe the cheek, you wipe the gums, and also the tongue, just to get the remnants of that food out of the oral cavity. Because like I said, like we mentioned earlier, you have bacteria naturally living inside of the mouth, and once you're providing food for these bacteria, you're basically altering the oral cavity, the normal balance of the bacteria in the oral cavity. So you want to get that remnant of that food out just so that you can have a clean mouth.
So how early would you recommend parents trying to make the effort to clean the baby's mouth? What age?
As soon as, well, babies eat. So once once you start eating, you have to get them into that routine, as Dr. Christmas mentioned. And Dr. Christmas mentioned about the rag, and then after that, once the teeth start to appear, there's something called a finger brush. I'm not sure how many persons are familiar with the finger brush. It's like something that slips onto the tip of your finger and has little like raised areas, and you use that to continue with the motion of cleaning, so that once again they continue to get accustomed. And after a few months, you upgrade to the soft toothbrush with this rice grain amount of toothpaste, because we don't want to overdo the toothpaste. And then after that, you upgrade to pea-sized amount of toothpaste.
I see your low fluoride toothpaste. Are the parents checking to see how much fluoride is in the toothpaste though?
Well, what you find sometimes is that the toothpaste that's recommended for children, they don't normally contain fluoride.
Okay, understood.
If I may add, we're cleaning the child mouth or children mouth, so you want to instill proper oral hygiene techniques. Well, one of the things is that we brush, but then we don't change the toothbrush. Next slide. Next slide.
Okay, can we have the next slide?
So it's important that you change the toothbrush.
Oh, wow.
Like,
I wonder how many persons' toothbrush looks just like this.
Yeah, so we have to reinforce that you change the toothbrush normally every 3 months or when it becomes frayed, whichever comes first. Kind of sometimes like there are school programs, so school comes to the dental clinic and we'd ask if you have a toothbrush, and again some people say they have a toothbrush since last year. Because they don't know that they're supposed to change the toothbrush.
Yes. So. Gotcha. And for me, periodically, I would even soak it in some hydroxide, like
hydrogen peroxide.
Sorry, yeah, hydrogen peroxide, so that in between brushes, sometimes I'm just a germaphobe. So yes. So we're gonna go on to the connection between your oral health and your overall health now.
So what we try to instill is that like your mouth is the gateway to your body. So if there are issues with your mouth, that can translate into your body, especially if you're immunocompromised, if you're diabetic. A lot of the systemic disease, the first appearance is within the mouth.
Within the mouth, okay.
So that's how we try to teach our patients that there's a direct connection between your mouth and your body.
Okay, I understand. Okay, so we're going to take another. This is not a break. We're going to go on to what's happening at Joseph and Franz Hospital with Dr. Jensen Morton with the medical bulletin from the desk of the Director of Health Institutions.
Dr. Jensen Morton, the Director of Health Institutions, and I'm coming to you live from JNF General Hospital. We're here in the back part of the facility, and behind me is where the state-of-the-art MRI facility is being constructed. So we would have come to you some months before when ground would have been broken on the facility. The facility now is in the advanced stages of construction. In about 2 months' time, the construction should be completed, and when this construction has been completed, it will take us another 2 months to get the machine in place and 100% installed. So we're aiming for June to have MRI services 100% available to the citizens of St. Kitts and Nevis. So this is a very important update, and we hope to come to you in a few months' time, maybe when the machine is coming, and then later when everything is fully installed, such that everyone can stay engaged with all steps of the process. We'd like to thank everyone that's been supportive of JNF General Hospital. This is just one of the areas of improvement of the current facility. There are multiple things happening at the facility every single day, and we'll be sure to keep you tuned, as well as in tune with what's happening when we break ground on the new hospital facility just 1 kilometer to the west of this current facility. So, thank you.
And welcome back. That was Dr. Jensen Morton with the medical bulletin from the desk of the Director of Health Institutions at JNF. We are going to take another short commercial break from National Bank. We'll be right back.
National Home Loans. Get your dream home, all could be yours. Walk through the door, come take what you need. Get you the keys, all could be yours. What you deserve, National Home Loans. Get your dream home, get your dream home. Right here, get your dream home. National Home Loans. Get your dream home.
National Home Loans. Home ownership made easy. When you're with National, you're home.
Welcome back. For those of you who have just joined us, welcome. And for those of you who have been with us from the start, welcome back. We're going to continue our program. Our topic for this evening is a healthy mouth is a healthy mind. I'm going to ask Dr. Liburd to finish his explanation on his topic.
So all along we've been reinforcing the need to instill proper oral hygiene practices within the child, but then we also need to educate the parents. And in this case, we want to educate the pregnant mothers. There's this notion of some female that are pregnant would say that, oh, people say, or the doctor said that you cannot come to the dentist. Mm-hmm. No, it is
but
important.
That's the time when your teeth becomes weak, no, as a mother, because not weak, but then because of the different hormonal changes, mm-hmm. you're more like susceptible to feeling a lot more, experience a lot more dental issues. I thought they said this because the child is now taking calcium from the mother.
No, that's a myth because like calcium is in your bone, so
mm-hmm.
why your teeth are not your bone, and you have more bone in your body than your teeth.
Makes sense.
Right? It's just that because of the hormonal changes, you find that the pregnant lady experience a lot more dental issues.
So her teeth falls out?
No, they don't fall out. So they should like get the routine checkup when they're pregnant. Mm-hmm. The issue is like not that you cannot get dental treatment done. Mm-hmm. is giving medication in the first trimester. So you just have to be careful because the baby is forming and growing. But after the first trimester, you can get any dental treatment done.
Okay.
And it's also important because having dental issues is a risk factor for low birth weight
in the
because in the baby, because the mother is not eating properly because she having like pain and those kind of things. So you're not eating, so it means that the child is not.
She's not gonna get the nutrition.
Yeah. And then there's also a risk factor for preterm delivery.
I had no idea.
Right? So it's important that the pregnant ladies actually come and get your checkup so that we can basically deal with the issues so your mom can be a lot healthier and then you have a more normal pregnancy.
Gotcha. Okay.
So one of the other challenges that you find during pregnancy also is that expectant moms, they have morning sickness. Morning sickness comes with vomiting. So you find that you have the presence of this acid inside the oral cavity. And the acid acting on top of the enamel, it creates a perfect environment where you can develop cavities. There's some persons who can't even put a toothbrush in their mouth when they're pregnant. So it's very important that if you're not able to do your proper cleaning at home, you visit the dentist. Get checks done to see exactly what's happening.
What do you mean they can't put a toothbrush in their mouth when it's for the whole 9 months?
Yes, I've seen cases like that. And you know, the funny thing is, fortunately for some persons, they could go through that period without cavities.
For the whole 9 months?
I've seen that happen, and then the other persons, they don't brush for a week and they develop cavities.
So the baby probably gives some extra protection? I'm just playing. Okay, interesting. All right. Okay, we're almost at the end of the program, so we're going to recap, unless we have any other topics to cover. I'm going to have Dr.
Right, so
we kind of didn't mention the treatment of
the dry mouth.
We
Yes.
kind of skipped past that, so we're going to go back. We're going to reiterate, and we're going to explain to persons how do you treat the dry mouth now.
Right. So as we had said previously, that the dry mouth is the feeling of dryness in the mouth, and we one of the causes was the certain medications causes dry mouth. It's one of the causes. And I had even read today that it is also said that can be up to 400 types of medications. 400 different medications can cause dry mouth.
Okay.
So, you know, it could very well be something that's common within our society. So we encourage persons, if they're experiencing dry mouth, they need to say, when they come to the dentist to get their check, they should indicate that, you know, hey, I'm feeling, my mouth is very dry, what do I do? So at that point, we usually recommend a saliva stimulant, usually something that's purchased in the pharmacy or the drugstore, and it comes in various forms. It can be a mouthwash. It can be, I've seen mouthwash here, but however, I'm not sure if other forms are available. I've seen they have the gum, they have the lozenges, I think they have the spray, they have the toothpaste. But whichever form of the product you get, you know, it would definitely help to decrease the dry mouth that you're experiencing. And also, on that note, we also encourage persons to drink lots of water. You know, it's the same thing, if you know you experience dry mouth, you know, increase the amount of intake of your water.
So there's like dry mouth and dehydration.
Probably they go hand in hand,
right?
They go hand in hand.
If I may, in terms of the mouthwash, it's not just any regular mouthwash, because the normal Listerine, it contains alcohol, and if your mouth is already dry, the alcohol gonna exacerbate the dryness.
Oh, alcohol as well would contribute to dry mouth?
Yes. So
I didn't
it's
know
an
that.
alcohol-free mouthwash.
Okay.
Right? That's called Biotine.
I think the active ingredient in it is xylitol.
So persons who smoke, persons who drink, persons who have certain medical conditions.
Who take prescription medications.
And who
They're
take
susceptible.
prescription medications.
It's possible that they may have dry mouth.
Namely diabetics and...
Person with hypertension,
okay,
that kind of thing.
They can potentially develop the dry mouth.
Potentially, yes.
Okay.
But they would need to speak up to their dental professional and indicate. I remember one time I had a patient and we were doing something regular and I happened to just look in her bag and she had all these lemons. So I said, why you have all these lemons? Oh, I have dry mouth. So she was using the lemons to suck on.
To make the mouth spring water.
Right, but then the lemons themselves are acidic.
Yeah, and it's gonna make your
then you are
crinkly.
so now she has increasing the acidic nature of her oral environment, which can lead to cavities. So we don't want persons sucking on lemons, but we encourage them to get the biotin or any other salivary stimulant.
And the biotin you can get over the counter. It's not a prescription.
Right.
Okay. Gotcha. So we are going to recap. We're going to go back to the top, and I guess we can tell the public one more time what your week of activities entail, what they can expect, and the date and time of was it an outpatient clinic outreach? Yes.
An outreach.
You can recap and let the public know what times they can come out, what to expect.
So we are celebrating Dental Health Week this week from the 16th of March to the 21st. Under the theme, A Happy Mouth is a Happy Mind. There was a church service yesterday at Rivers of Living Water Christian Center. We are here tonight at HealthWise. Tomorrow, Tuesday and Wednesday, we will be going to the various schools. At the school,
all of the schools, high school?
No, primary schools.
Primary schools.
We will focusing on kindergarten and grade 1. Like we said, we want to instill proper oral hygiene practices
from young.
So we have teaching aids where we actually have them come and brush, see how they brush, and teach them the proper way of brushing. Also indicate what is flossing and when you should floss. And then on Thursday, we have the dentition community outreach where we're going to be at Princess Street in Basday. That's the junction between 4th Street and Princess Street.
So it would be yourself and all of...
It's a whole dental staff, right? So we know that that's an area where people traverse a lot, so we want to captivate the attention as many passers-by. We do the education drive, like explain what is the same brushing, flossing, any questions that they might have, we can answer.
And referrals, consultations.
And then we're going to do some screenings where we do simple examinations and we refer them to various dental clinics.
Well, one thing we didn't mention about elderly persons that might be using dentures. I know overseas it's a thing for elders to soak the dentures overnight, but I know of some elders they keep it in their mouth overnight and they don't soak it. Is there any adverse issues with them doing that with bacteria and stuff?
Well, the first thing they did wrong is to not take it out of their mouth, because you need to clean your mouth to brush. If you have remaining teeth, you need to take out denture out of your mouth and clean the remaining teeth if you're in that situation.
I tried explaining that to
However, if you have full dentures, then you still need to take out the denture out of your mouth to give your mouth a rest, to give your tissues a rest. I often tell patients you don't need your denture while you're sleeping. You're not speaking, you're not smiling, and you're not eating when you're sleeping.
I'm glad you said that for the person who I tried to help the last time about this process. So we're going to do one more video, and then that would wrap up the show for us.
A happy mouth is a happy mind. Joyfulness, confidence, quality of life, big smiles. A happy mouth is a happy...
Okay, thank you very much. So that would be coming on to the end of our show. Thanks again, you guys, for tuning in. My name is Dr. Monique Lescott, and our topic for this evening was A Healthy Mouth is a Healthy Mind. We had 3 dentists, 3 of, I would say, the best surgeons, dental surgeons, and was dental officer and orthodontist. You can reintroduce yourself, and that would be the end of our show. We had Dr.
Randy Liburd. I'm the Chief Dental Officer within the Dental Department in the Ministry of Health, and by specialty, I'm an orthodontist. I specialize in braces.
Oh, okay, that's good to know. Where's your office, you said?
I work along with Dr. Christmas at City Dental.
Yeah. Okay.
Dr. Therese Rawlins, general dentist.
And where are you located?
Oh, my private practice is on Victoria Road, opposite Medical Associates.
Awesome.
Dr. Trevor Christmas. I operate at City Dental and Rosemary Lane also.
So that was our show for this evening. We'd like to thank you guys for tuning in, and have a blessed evening.